How do you know if your physical therapist is pushing too much? Not just pushing on your knee too much, but what about pushing you, the patient, too much? What happens when your physical therapist gets a little too aggressive? What is enough? We all know total knee replacement recovery is a challenge. We know it's hard. We know it takes work. It's persevering. But how do we find that line, especially if you're a patient who's never had a knee replacement and you have nothing to compare it to? Hey guys, my name is Tony Maritato. I'm a licensed physical therapist and I specialize in treating patients after total knee replacement surgery. So I get this question a lot, and I'm reading this question from my total knee replacement support group on Facebook. I'll share the link down below. But this is a great question. It's a judgment call. Now, everybody is going to be different. So my typical response to a patient who's unsure about how hard to push themselves or how hard to allow me to push them, I tell them the same thing every time. It almost doesn't matter how it feels at the time. It's how do you feel later? How do you feel 20 minutes later? How do you feel 3 hours later? And how do you feel that night? If you go to a therapy session and your therapist is a little aggressive, but it's tolerable, and you recover back to baseline, so that night you're feeling the way you felt last night, I think you're good. I think that you're at a good level. It's got enough intensity to create a response in the body to move you toward your goal, but it's not so aggressive that it makes you worse. The problem comes when, again, your therapist gets a little aggressive. You can tolerate it, but then that night, you're in more pain, you're more swollen, and you're more sore. Because what happens is, even if there's any benefit to getting a little more aggressive, which I don't believe there is, you're going to experience a setback, which is increased swelling, increased pain, increased redness, stiffness, which means you're not going to get to work on your range of motion other times of the day. So typically in a situation like that, I tell my patient, if you feel worse tonight, or if you feel worse tomorrow morning, we did too much. Whether I did too much as your therapist or you did too much as the patient. But if you recover back to baseline tonight, tomorrow, you're back to where you were yesterday, we can repeat the episode. We can do the same intensity. We want to find those barriers. And I'm the first one to tell you that every day is going to be different and every patient is going to be different. There are some days that a patient is going to push themselves harder and farther than they did the day before. That's okay, because then there's also going to be days where the patient's not going to do anything, and that's okay too. Most of the time when I'm working with a patient who's really aggressive, they're pushing themselves, or they have a therapist that's pushing them and they're not making progress, but they tell me they're doing their exercises 2 and 3 times a day. My typical response is, have you tried taking a break? Have you tried taking a day or 2 off, allowing your body to recover? You know, you're no different. We're watching the Olympics right now. You're no different than those Olympic athletes. There is a cycle to work, rest, and recovery. If you just work, and never give your body the chance to recover, or your therapist makes you work, and never gives your body a chance to recover, you're never going to be able to experience the improvement that you should have. So pay attention to how you feel tonight, tomorrow. If you feel worse, more pain, more swelling, more redness, it was too much. If you're back to baseline, or even if you feel better, probably the right intensity. But now the next session, we have to recalibrate, because you might be more sensitive, you might be less sensitive, you may be able to do more, or you may just need to take a break.